First off, I want to know what activities or relationships cause you the most stress. Tests? Okay. That's it?
Deadlines.
Really? Come on, what?
Deadlines.
Deadlines?
Work, college, life balance.
Yeah.
Everything.
That's kind of broad. That's like just me. You could just say me, right? Any relationships cause you more stress? I mean, really, think about it.
My mother-in-law.
Mother-in-law? Okay. And holidays are coming. Yeah, yay, right? Okay, all right, so think about those things that we identified. What warning signs do you get that something's stressful? How do you know you're stressing? You cry? What? Tense, okay, muscles tense.
You're short with people.
Short with people. You yell at people. You break out in hives. Okay? Okay, then the next question is, what do you do about it? What do you do about crying? Do you just cry? Okay. Yeah, what's wrong with that, right? Okay, except not in the middle of class. Don't do it then, no. Okay, what else? Muscles tense. What do you do about it? Just let them tense? Okay, then what happens? It becomes a headache? Then you can't sleep? Okay, see, so, yeah, there you go. All right, so somebody else, what do you do about that stress? Nobody has any healthy thing? I mean,
No.
crying out loud and doing it is okay. Nobody has anything healthy that you do to decrease your stress?
Take a bath.
It's gonna be a great lecture today then. Take a bath. There you go. Nice warm water and some bubbles and quiet. Maybe a book. I don't know.
I walk away.
You walk?
Walk away.
Walk away. Okay. All right, that's where we're going today. And the thing is that, you know what? You can identify what it is, but what do we do about it? Because you're not going to be very good teachers to your patients if you're not the role model, if you don't know how to take care of it. And school is stressful, okay? So we're going to move into sleep, but who's the most supportive, the number one person? You don't have to say this out loud, but who is that person that's supportive of you, who's the most important? Okay, because if you can't think of somebody, we need to deal with that as well. We need to find somebody. It may not be a family, it may not be a spouse, it could be a really good friend, all right? It could be a classmate. But we have to have somebody who's going to support not just the good things in our life, but they're going to support, okay, when things aren't so great, they don't just tell you what you want to hear. We need to be able to go down that for ourselves today. So today's going to be a lot of self-reflection. How am I doing? Because you can, if you're not doing well, you can do better, and then that will equate to patient care. It'll equate to home life. So this is pretty huge today. All right, so flip. All right, so we have different functions of sleep. So sleep is one of the areas when we talk about stress, because obviously if we don't get enough sleep, we don't get good sleep, we're going to be stressed. Or we're not sleeping because we're stressed. So when we talk about the functions of sleep, this is just the definitions there on your slide. When you're at rest, you have a decreased state of activity. I mean, right now you're actually, unless your mind is just going, you're at a state of rest right here listening to me, okay? You know, if you're stressed out, there's really not any reason to be stressed out. We're here, let's just talk about it, okay? When you're sleeping though, you should have an altered unconsciousness. And we're going to talk about the different stages of sleep that people get into. Melatonin. Melatonin is that hormone that is to help us to sleep. Some of us need to take some melatonin natural melatonin to help us sleep. Nothing wrong with that because melatonin is good. It's gonna help us to regulate the wake and sleep cycle. And if we need a little bit of that, it's okay, all right? Especially going through school and trying to work and have a home and all of this. It's okay, but we need good sleep. Circadian rhythms is a part of a function of sleep because you do go through different stages. It is the 24-hour cycle that you go through biologically, it originates there in the hypothalamus. So these are functions of sleep that we want to know about. Fatigue can be considered a normal protective body mechanism and a natural warning that sleep is necessary. So when you get tired, when you get fatigued, it's your body telling you you need some rest and potentially you need sleep. So we can't just go and, you don't catch up on sleep. So if you're pulling all-nighters, you're not gonna catch up on that sleep because you'll take a good nap and then you'll sleep that night. You're not gonna catch up. It's gone. That 24-hour cycle is gone. So that's why all-nighters aren't good. All right, we need our rest. I forgot to check to see if this would even play. My bad, because this is if it doesn't, you guys will want to write this website down and watch this TED Talk. Let's see if it'll do it. It might. Might not get any sound though. Yeah, that's what I was afraid of. Hang on. Okay, it's unmuted there. Why are we not getting any sound? Well, we might not be able to watch it. Or maybe I'll try to get it right, because I don't wanna.
Can you pull it up on the desktop?
Probably can. Yeah, but I have to, where's my PowerPoint? No. Okay, now what happened to my, there it is. Let's see, I'm sorry guys, I totally forgot about it. Then I'll probably blast your ears out. Where am I putting my note? Let's see. Still not making any sound. What's wrong?
Did you switch the input over to
Should be able to see it. There we go. Let's see. Okay. Turn it up as loud as you need it. Then you get it. Here we go. It's not that long, so. It's less than that.
Thank you very much. Well, I would like to start with testicles. Men who sleep 5 hours a night have significantly smaller testicles than those who sleep 7 hours or more. In addition, men who routinely sleep just 4 to 5 hours a night will have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age a man by a decade in terms of that critical aspect of wellness. And we see equivalent impairments in female reproductive health caused by a lack of sleep. This is the best news that I have for you today. From this point, it may only get worse. Not only will I tell you about the wonderfully good things that happen when you get sleep, but the alarmingly bad things that happen when you don't get enough, both for your brain and for your body. Let me start with the brain and the functions of learning and memory. Because what we've discovered over the past 10 or so years is that you need sleep after learning to essentially hit the save button on those new memories so that you don't forget. But recently we discovered that you also need sleep before learning. And now to actually prepare your brain, almost like a dry sponge, ready to initially soak up new information. And without sleep, the memory circuits of the brain essentially become waterlogged, as it were, and you can't absorb new memories. So let me show you the data. Here in this study, we decided to test the hypothesis that pulling the all-nighter was a good idea. So we took a group of individuals and we assigned them to one of two experimental groups, a sleep group and a sleep deprivation group. Now the sleep group, they're going to get a full 8 hours of slumber, but the deprivation group, we're going to keep them awake in the laboratory under full supervision. There's no naps or caffeine, by the way, so it's miserable for everyone involved. And then the next day, we're going to place those participants inside an MRI scanner. I'm going to have them try and learn a whole list of new facts as we're taking snapshots of brain activity. And then we're going to test them to see how effective that learning has been. And that's what you're looking at here on the vertical axis. And when you put those two groups head to head, what you find is a quite significant 40% deficit in the ability of the brain to make new memories without sleep. I think this should be concerning considering what we know is happening to sleep in our education populations right now. In fact, to put that in context, it would be the difference in a child acing an exam versus failing it miserably, 40%. And we've gone on to discover what goes wrong within your brain to produce these types of learning disabilities. And there's a structure that sits on the left and the right side of your brain called the hippocampus. And you can think of the hippocampus almost like the informational inbox of your brain. It's very good at receiving new memory files and then holding on to them. And when you look at this structure in those people who had a full night of sleep, we saw lots of healthy learning-related activity. Yet in those people who were sleep deprived, we actually couldn't find any significant signal whatsoever. So it's almost as though sleep deprivation had shut down your memory inbox, and any new incoming files, they were just being bounced. You couldn't effectively commit new experiences to memory. So that's the bad that can happen if I were to take sleep away from you. But let me just come back to that control group for a second. Do you remember those folks that got a full 8 hours of sleep? Well, we can ask a very different question. What is it about the physiological quality of your sleep when you do get it that restores and enhances your memory and learning ability each and every day? And by placing electrodes all over the head, what we've discovered is that there are big, powerful brain waves that happen during the very deepest stages of sleep that have riding on top of them these spectacular bursts of electrical activity that we call sleep spindles. And it's the combined quality of these deep sleep brain waves that acts like a file transfer mechanism at night, shifting memories from a short-term vulnerable reservoir to a more permanent long-term storage site within the brain, and therefore protecting them, making them safe. And it is important that we understand what during sleep actually transacts these memory benefits, because there are real medical and societal implications. And let me just tell you about one area that we've moved this work out into clinically, which is the context of aging and dementia. Because it's, of course, no secret that as we get older, our learning and memory abilities begin to fade and decline. But what we've also discovered is that a physiological signature of aging is that your sleep gets worse, especially that deep quality of sleep that I was just discussing. And only last year, we finally published evidence that these two things, they're not simply co-occurring, they are significantly interrelated. And it suggests that the disruption of deep sleep is an underappreciated factor that is contributing to cognitive decline or memory decline in aging, and most recently we've discovered in Alzheimer's disease as well. Now, I know this is remarkably depressing news. It's in the mail, it's coming at you, but there's a potential silver lining here. Unlike many of the other factors that we know are associated with aging, for example, changes in the physical structure of the brain, that's fiendishly difficult to treat. But that sleep is a missing piece in the explanatory puzzle of aging and Alzheimer's is exciting because we may be able to do something about it. And one way that we are approaching this at my sleep center is not by using sleeping pills, by the way. Unfortunately, they are blunt instruments that do not produce naturalistic sleep. Instead, we're actually developing a method based on this. It's called direct current brain stimulation. You insert a small amount of voltage into the brain, so small you typically don't feel it, but it has a measurable impact. Now, if you apply this stimulation during sleep in young, healthy adults, as if you're sort of singing in time with those deep sleep brainwaves, not only can you amplify the size of those deep sleep brainwaves, but in doing so, we can almost double the amount of memory benefit that you get from sleep. The question now is whether we can translate this same affordable, potentially portable piece of technology into older adults and those with dementia. Can we restore back some healthy quality of deep sleep? And in doing so, can we salvage aspects of their learning and memory function? That is my real hope now. That's one of our moonshot goals, as it were. So that's an example of sleep for your brain, but sleep is just as essential for your body. We've already spoken about sleep loss and your reproductive system. Or I can tell you about sleep loss and your cardiovascular system, and that all it takes is 1 hour. Because there is a global experiment performed on 1.6 billion people across 70 countries twice a year. And it's called daylight savings time. Now, in the spring, when we lose 1 hour of sleep, we see a subsequent 24% increase in heart attacks that following day. In the autumn, when we gain an hour of sleep, we see a 21% reduction in heart attacks. Isn't that incredible? And you see exactly the same profile for car crashes, road traffic accidents, even suicide rates. But as a deeper dive, I want to focus on this, sleep loss and your immune system. And here I'll introduce these delightful blue elements in the image. They are called natural killer cells. And you can think of natural killer cells almost like the Secret Service agents of your immune system. They are very good at identifying dangerous, unwanted elements and eliminating them. In fact, what they're doing here is destroying a cancerous tumor mass. So what you wish for is a virile set of these immune assassins at all times. And tragically, that's what you don't have if you're not sleeping enough. So here in this experiment, you're not going to have your sleep deprived for an entire night. You're simply going to have your sleep restricted to 4 hours for one single night. And then we're going to look to see what's the percent reduction in immune cell activity that you suffer. And it's not small, it's not 10%, it's not 20%. There was a 70% drop in natural killer cell activity. That's a concerning state of immune deficiency. And you can perhaps understand why we're now finding significant links between short sleep duration and your risk for the development of numerous forms of cancer. Currently, that list includes cancer of the bowel, cancer of the prostate, and cancer of the breast. In fact, the link between a lack of sleep and cancer is now so strong that the World Health Organization has classified any form of nighttime shift work as a probable carcinogen because of a disruption of your sleep-wake rhythms. So you may have heard of that old maxim that you can sleep when you're dead. Well, I'm being quite serious now. It is mortally unwise advice. We know this from epidemiological studies across millions of individuals. There's a simple truth. The shorter your sleep, the shorter your life. Short sleep predicts all-cause mortality. And if increasing your risk for the development of cancer or even Alzheimer's disease were not sufficiently disquieting, we have since discovered that a lack of sleep will even erode the very fabric of biological life itself, your DNA genetic code. So here in this study, they took a group of healthy adults and they limited them to 6 hours of sleep a night for 1 week. And then they measured the change in their gene activity profile relative to when those same individuals were getting a full 8 hours of sleep a night. And there were two critical findings. First, a sizable and significant 711 genes were distorted in their activity, caused by a lack of sleep. The second result was that about half of those genes were actually increased in their activity, the other half were decreased. Now, those genes that were switched off by a lack of sleep were genes associated with your immune system. So once again, you can see that immune deficiency. In contrast, those genes that were actually upregulated or increased by way of a lack of sleep were genes associated with the promotion of tumors, genes associated with long-term chronic inflammation within the body, and genes associated with stress and, as a consequence, cardiovascular disease. There is simply no aspect of your wellness that can retreat at the sign of sleep deprivation and get away unscathed. It's rather like a broken water pipe in your home. Sleep loss will leak down into every nook and cranny of your physiology. Even tampering with the very DNA nucleic alphabet that spells out your daily health narrative. And at this point, you may be thinking, my goodness, how do I start to get better sleep? What are your tips for good sleep? Well, beyond avoiding the damaging and harmful impact of alcohol and caffeine on sleep, and if you're struggling with sleep at night, avoiding naps during the day, I have two pieces of advice for you. The first is regularity. Go to bed at the same time, wake up at the same time. No matter whether it's the weekday or the weekend, regularity is king, and it will anchor your sleep and improve the quantity and the quality of that sleep. The second is keep it cool. Your body needs to drop its core temperature by about 2 to 3 degrees Fahrenheit to initiate sleep and then to stay asleep. And it's the reason you will always find it easier to fall asleep in a room that's too cold than too hot. So aim for a bedroom temperature of around 65 degrees or about 18 degrees Celsius. That's going to be optimal for the sleep of most people. And then finally, in taking a step back then, what is the mission critical statement here? Well, I think it may be this. Sleep, unfortunately, is not an optional lifestyle luxury. Sleep is a non-negotiable biological necessity. It is your life support system, and it is Mother Nature's best effort yet at immortality. And the decimation of sleep throughout industrialized nations is having a catastrophic impact on our health, our wellness, even the safety and the education of our children.
That's good. All right, now that I depressed you all, right? Feel better? Get that straight. No, we don't feel better, do we? But I couldn't have said it better. So that's why I play that, because obviously he has a sleep study center. He knows a lot more about this than I do. I just know the effects of it, and I know what's happening. So let's look at our stages of sleep, okay? So we have NREM, which is non-REM sleep, rapid eye movement. This is about 75%, which that's the 4 stages right there. So you're in non-REM sleep for 4 stages, which is about 75% of your sleep time. In stage 1, okay, you begin to relax. You even if you're just sitting in the chair and you're gonna fall asleep, your body will relax. And that's when stage 1 starts. It's the relaxation stage. And sometimes your body jerks because you're trying to relax. And you can be aroused very easily. And this is about, of that 75%, this is only about 5%. It doesn't take too long to move right through this stage to stage 2, which is still some of the muscles relaxing. You are still able to be aroused easily, but you're falling into more of a deeper sleep, which this is 50 to 55% of that 75. So this is where you mostly spend your sleep time, is right here in stage 2. Then stage 3 is you're less arousable, takes a little longer, gotta shake ya, talk louder, yell at somebody to wake up. And this is only about 10% where you spend. And then the last stage is called delta sleep. Your muscles are relaxed. The important part here is that your vital signs have decreased. So your blood pressure's dropped, even your temperature hopefully has dropped, like he said, a couple degrees, and your heart rate, your breathing slows down, and you're about 10% here. Then hopefully after that, you're 75%, you spend the rest, the 25% in REM sleep, which is rapid eye movement. And you can sometimes see that with somebody because the muscles are moving in the eyes and you can see them in REM. This is most times when you're in REM, when you are difficult to arouse, but you dream in REM sleep. So you get some learning during this time and memory, like he talked about during REM sleep. So we want REM sleep. And in REM sleep then, because you're dreaming, because you are very relaxed, your vital signs actually start to increase, okay? So your vital signs increase, or sometimes there's an irregularity there. You can see people twitch, and that might be they're fighting a bear in their sleep or something, I don't know. You know, they might yell out, but if you get 7 hours of sleep a night, if you're in REM sleep, that's about a little less than 2 hours you're in REM sleep. Okay, so then, but then if you move to, you sleep about 9 hours a night, this is where you're gonna spend 2 hours of your sleeping time, is during this phase right here, this stage, REM sleep, okay? So we understand that. So if we look at this question, A nurse observes a slight increase in a patient's vital signs. So what should that tell us right there? We're in REM sleep, okay. And so according to the patient's stage of sleep, the nurse expects what? Are you aware of your surroundings at this point? If you are in REM sleep, no, you are not. B, you're in delta sleep. No, because that's what stage? Stage 4. All right? It would be most difficult to awaken this person at this time. Yes, this is REM sleep. D, this is the most likely non-REM stage. No, we already identified it was REM sleep. E, this stage constitutes around 20 to 25%. Yes, okay. And the muscles are relaxed in this stage. This, where did I say the muscles relax? Stage 1, stage 2, okay? Because we're daydreaming and we're not arousable at this point, right? And our vital signs might increase. Okay, just a little question there. So, the physiology of sleep. My guy, the TED Talk there, Matt, I like listening to that British accent anyway, or Australian accent anyway. But he talked about the physiology of sleep a little bit. How many hours of sleep should we be getting? What to what? 8's great. 7 to 9, okay? We as adults should be getting 7 to 9. How many of you are getting 7 to 9 hours of sleep a night? Great. Good. It's actually about half the class. Have no problem sleeping, okay? Great. Do you go to bed at the same time like he said? No? Okay. I do. Yeah. I try to go to bed at the same time. If you've got a family and kids, sometimes that is difficult, but putting your kids on a schedule and regularity is great for them as well. And that will give you more regularity. But yeah, about 7 to 9 hours of sleep, because it will have a good outcome with your health, just like Matt said there. If you are less, you sleep the less recommended amount of hours. So if you're sleeping less than 7 hours, more likely you're overweight as well. It comes with the territory, because what happens is you have a couple hormones, leptin and ghrelin. Have you heard of those? No, you haven't heard of leptin and ghrelin? Okay, so the leptin hormone, when it's released, it helps us to stop eating. You know, it tells our body we're full. So that when that was released, okay, so what happens is if you are sleep deprived, it lowers leptin, which then means it doesn't help me to stop eating. I want to eat more. All right? So ghrelin then is the one that promotes eating. So it says, you know, time to eat. We want ghrelin to be stimulated. When it is, we want to eat. Leptin helps us to stop eat. Ghrelin says eat, okay? But what happens if you're sleep deprived with ghrelin? It's elevated, so your appetite's increased. So you eat more again. You get up in the middle of the night, it's not a good idea to eat, okay? But it switches on ghrelin, and you want to eat, okay? So those hormones, we gotta keep them balanced and equal. So the other part of all of this then is our metabolism. Our metabolism is decreased, which means it does not moving things, and we gain weight, all right? So we gain weight. If you have a shortened sleep by just a few hours, so if let's say you're getting 5 hours of sleep a night, that's the same reaction as someone who is totally intoxicated. And you're driving. You're going to work. You're given medications. Not a good idea. That's why we need to have our sleep, okay? Because we do not want to compromise patient safety. We do not want to compromise our own safety. All right, so let's talk about what influences our sleep or rest, okay? Developmentally, sleep patterns are regulated based on our age. Just like he said, when you get older, for some reason it seems like your body doesn't need as much sleep. You know, older people will sleep 5 hours, and they can, but they take naps a lot of times. So developmentally, it is kind of related to age. You know, babies, some babies sleep through the night real good, you know, in the first couple months, and some don't. Okay, so for young adults, once again, we need 7 to 9 hours of sleep a night. What is the motivation that influences our sleep? Okay, are we motivated? Do you desire to be awake or overcome sleepiness? Okay, what's your motivation? Like to stay awake? Like he said, don't take naps. But I need a nap. Okay, I worked all night or whatever it is. I was up with the kids. I need a nap. Your motivation is, no, don't sleep. My husband, we've been married over 30 years, and he does not sleep well. Has not for 30 years. And he's tried melatonin. I mean, we've tried everything. And so he doesn't sleep well. When he doesn't sleep well, and like if I'm out in the evening, he says, yeah, I might be in bed when I get home, you know, and it's 8:30, okay? But I get home and he's not in bed, and it's like, what? He said, I need to keep myself awake so that I will sleep. So he tries to stay awake even though he hasn't slept, so then he will sleep. So what's the motivation of people who don't sleep? What's the motivation? That influences how you sleep or don't sleep. Culture, sometimes there's bedtime rituals, certain things to certain cultures they have to do before they go to bed. You know, we need to read a book, we need to have prayer time, we need to do certain things. So there might be rituals that influence sleep, and places and different things that people do. Our lifestyle, our habits, obviously, definitely influence our sleep, right? What shift do you work? Like nights? I never could get on nights. I tried one long time ago. There weren't day shift positions open. You started on nights. You didn't have a choice. And so I worked nights at the psych center, at the mental health unit, and I never knew when to eat, go to the bathroom. It was terrible because I didn't sleep well. I'm a day person. I want to sleep at night and get up early. So if I have to work that 7 o'clock shift, or actually back in the day it was 8 hours, so it's 11 to 7. So I would go in at 11 o'clock at night, and it's like, and then you have 2 days off, but not in a row. So do I sleep the regular time that I do? And when do I eat supper? Do you eat supper at 4 in the morning? You know, I just never could figure it out. So if you're a nighttime person, it is difficult. And you know, the world runs on daytime. So it's really hard to get your circadian rhythms in the way it should be, to get actual REM sleep. It's really difficult. You fall asleep, but you've just taken those power naps. So those aren't, you're getting into REM sleep. Okay, what else? Environmentally. What do I mean by that? Anybody live by a train? Okay, you live by a train, and it probably bothered you at first, but now it's like, I don't even hear it. Okay, but some people never get used to it. So environmentally, that can influence our if the sirens are going off. My daughter lives by the firehouse, and the ambulance leaves, and it's like, you know, that you get used to it, but you know, you have to, it does affect your sleep. Psychologically, sometimes what we mean by that could be that if you have comorbidities, other illnesses that might affect that. Hopefully you're not taking, like a patient isn't taking Lasix at night and they're having to get up and go to the bathroom, things like that. So that's the psychological part. Illness, if you have an illness such as like seizures, GERD, you know, if the patient isn't sleeping with their head up and all that acid is coming back, they're not sleeping well, their nutrition is blown. And then what's the last one? If you're on medications, yeah, just like I said, we want to be able to tell our patients when they should take the medicines. They're supposed to take them before they eat, a certain amount of time. Should they not take Lasix in the evening, they should take it in the morning, yes. We need to know those things about our medications so that our patients can sleep. These are some common sleep disorders. The ones that I have highlighted in color, which are insomnia, SRBD, which is sleep-related breathing disorder, and the circadian rhythm are the most common ones. That's why I put them in color. Insomnia is obviously the most common of all sleep disorders. They have difficulty sleeping, they sleep intermittently, they might sleep really well for 2 hours, and then they're awake. And they might be awake for half an hour, or they might be awake for 3 hours. So insomnia is a very difficult to maintain a sleep pattern. The sleep-related breathing disorder is basically obstructive sleep apnea. So that's the picture I have there. So somebody who has done a sleep study test, and while they're sleeping, they can determine how many times that person stopped breathing, had apnea. And when they do that, then they need oxygen through the night. They need negative pressure air to be given to them so that they don't stop breathing. That's what sleep apnea is. And it's called a CPAP, and it stands for continuous positive airway pressure. Okay, so it's positive air, not negative, I'm sorry. Circadian sleep rhythm wake disorder, then that's just when things are disrupted. Okay, you hear the plane go over, the train, could be jet lag. You know, people talk about that. Even now, as we switch to daylight savings time, we could see some of this disruption as well. I heard one of my colleagues talking today saying, I wish they would stop doing that because I just lay there awake till it's time to get up, because your body's, if you have a regular pattern, it's used to getting up at a certain time. So it doesn't matter that the clock changed, your body still says get up, you know, okay? And hypersomnolence, which is hyper would be excessive. So this is excessive sleep. Too much sleep is not a good thing either, because then you're not moving, you're not eating properly. So people who want to sleep all the time, it goes against, you know, our body's natural rhythms that we should have. Parasomnias is just, it's a lot with kids. They have a awake behavior, okay, and it might mean that they are, you know, afraid of something, or they dreamed something and it woke them up, and they can't go back to sleep because they don't want to go back to sleep. So there's some parasomnias there. And then the SRMD is a lot of times where you see restless leg syndrome. That's like underneath here. People whose legs keep going even though, and it's hard to relax when your legs are moving and you're not doing it, it's just naturally happening. So that happens to about 15% of people. That's a huge population. And then what can we do about sleep deprivation? Can we do anything? You know, you want to think about things like, you know, not taking caffeine after 6 o'clock in the evening or 7 o'clock in the evening. Don't eat after that, even a snack. And alcohol, smoking, all of those things play a part in sleeping. And sleeping is essential for our well-being. It's essential for our body physiologically. So here's a question. A nurse observes involuntary muscle jerking in a sleeping patient. What would be your next action? What do we think? I heard A. Anything else? Okay, so what do you think? Involuntary muscle jerking, what stage might they be in?
There's like a medicine too, so I would call the primary care if it's like too much.
Okay, you would call the primary care if it's too much. Somebody said REM. No, it's non-REM. Okay, because it's involuntary. Remember, our muscles relax when? Stage 1. Okay, so that's non-REM, and that's a normal finding. You're normally going to do that when you fall asleep. And what you would want to do is, you don't do any action, it's a normal finding, okay? If it would continue, but it doesn't say that in the question, okay? Just says that you saw the involuntary, so be careful. You don't want to read too much in the question. Okay, so what are some nursing implications? What does all this mean for us as nurses? Okay, we talked about you need to have good sleep, but then what if in the hospital? You know, you'll hear people say, and I don't like to be in the hospital, you don't get any rest, do we? Because we're going in, the aid's going in every 4 hours, every 2 hours, whatever it is, taking your vital signs, and somehow they just don't talk with the nurse or the LPN or somebody, and then within the next hour, it's medication time. And then, you know, you're about to fall back asleep again, and they come in and they draw blood or something. You know, they're going to do a test. And sometimes they don't even, like, shut the unit down. Turn the lights down in the hallway. Shut my door. You don't get good sleep in the hospital, do we? But we are the ones that can promote that or not as well for our patients as best we can. So if we have a patient, we're going to do an assessment, aren't we? We're going to find out and ask questions, which we don't always do. But if you're the night shift nurse, you might want to be asking these because you're probably not doing the full assessment intake of the patient. But now they're there at night and you're the nurse working. So to ask questions like, you know, do you have problems sleeping at home? What helps you to sleep? Okay, it might be they need to have the television on, very quiet, you know, and that's how they sleep. They might want it cooler in the room. Drop the temperature, because I sleep with a fan all night. What can we do in the hospital for them? So are there signs and symptoms that they're not sleeping? When we talk about, what do I have on there, timing? Yeah, talk to the aide. You know, usually they go at 12, 4, and 8 to get vital signs. So can I line up some things? They do theirs a little bit later. We go in and we do it, or I'll do the vital signs while I'm in there getting the medicine. And we work together timing-wise on night shift so that our patients can sleep, okay? So we diagnose if there is a problem, if they have a disturbed sleep. It might only be in the hospital that they have a disturbed sleep pattern, because I sleep fine at home, but I don't sleep so great in the hospital. That just might be part of it. So some strategies that we can use are creating a restful environment, you know, lower the lights, close the door, and maybe not close it all the way, because every time you open it, it makes noise. Or leaving it just enough open so that you can see the patient and let them know that. So you're not continually opening the door to check on them, okay? That they're all right. But make sure their bed's comfortable. If they're not comfortable in their bed, they're not gonna sleep. And maybe they need some clean linens. You know, it's simple things, guys. It's not huge things that we have to do just to create an environment for our patient to sleep. Decreasing the temperature, like we said. And when you do that, when you decrease the temperature, it does release melatonin naturally. So if you guys aren't doing that at home, you might want to think about it. Have a fan on, that's also white noise going, okay? Be alert to the patient's individual rituals. You know, if they take a shower at night and they can take a shower, maybe we should let them take a shower so they'll relax and they can go to sleep. So if they have a ritual and we can abide and help them to get that, then we should do that. Food. Don't have excessive fluid before you go to bed, right? So if the patient's asking for coffee in the evening, you know, is it decaf? We probably should suggest maybe we don't have that, because you'll be up going to the bathroom. And maybe that's what they do at home, but that's a teaching moment for us to tell our patients, you know, try to set a time where you don't drink after that, okay? What else do we have on there? Relaxation and comfort. Maybe they need a back rub. Maybe they need some noise, some music going. Maybe they need something like that. Maybe they need a heated blanket where they feel warm, but the temperature in the room's cool, so then their body will eventually go down, but it's a relaxation thing. Do they need some pain medication? They might, because they're not gonna relax and go to sleep if they're in pain. They're just really not gonna do that. And try not to disturb them. Don't wake them up to give them a sleeping pill. It happens, trust me, okay? It's on the orders. You have clinical judgment, nursing judgment. If you're patient, you walk in there or walk by and they're snoring, they're in good REM sleep, and they have been, just document what was happening. Don't go in there and give them a sleeping pill. Okay? Now, they may wake up later, like say they fell asleep at 11 o'clock, and a couple hours later they woke up and they can't go back to sleep. Then you have to use judgment whether you're going to give it that late or not. But you would still have it to give. What else do I have on there? Teaching. Explain that all those things I just talked about are ways for them to have good sleep. If they tell you that they don't sleep well at home, that's a teaching moment. What are your rituals? Do you have any? What time do you go to bed? And they tell you, it just depends. That's where you can then input things that we just learned from Matt, how important it is to get good sleep, and what are the things that they could do. What are the things that they're currently doing or not doing, and then how could we affect that? And if I'm speaking to anybody right here that you're not doing these things, this is a great opportunity for you to change some things that you're doing to try to get better sleep. Remember, that's gonna activate the hippocampus and you're gonna learn better. If you read books about that, you will learn better. It's not a good idea to just study till 11 o'clock and go to bed. It's better to get your sleep and then study. All right, so during the day is better to sleep. So let's talk about this critical thinking. It's too small. So you just arrived on that. This is really true. This is what happens with you guys with clinical. You arrive on the unit, you check your clinical assignment. You have 2 patients today, and you have about 30 minutes before pre-conference. So you review the charts, you get the pertinent information, you introduce yourself to your patients, you take their vitals, and then you go to pre-conference. With 10 minutes to spare though, you visit your second patient and find that he is sound asleep. So this is gonna be like 6:30, 7 o'clock in the morning, 6:45. So you remember that he had a fractured hip, repaired 2 days ago, and that the night nurse stated that the patient was restless and awake until 4 o'clock. So you're reluctant to awaken him. That's good, right? Okay, so if you're reluctant to awaken him, on the other hand, at your midterm conference, your instructor commented that you need to improve your organizational skills. If you don't have your vital signs recorded until after pre-conference, then breakfast arrives, the doctors make rounds, and you're farther behind in your morning care and your documentation. So when you look at the last set of vitals documented in the electronic health record for midnight, you see that this patient's vital signs were within normal limits. The one that's still sleeping and didn't go to sleep till 4 in the morning. So you're attempted to reconcile several things. The importance of morning vitals, the patient's need for sleep, and your need to finish your tasks on time and get a good evaluation. So here's my question. Is it more important to awaken the patient or to let them sleep? Everybody in agreement to let them sleep? All right, we're gonna let them sleep. Do you need any more information to let this patient sleep? And if so, what? Anybody can't think of anything?
If they have morning medication.
Okay, we could look at the meds, definitely. And what are they? Okay, good.
What their plan is for the day, like if they were to have surgery or a procedure done, and they need to be awake by a certain time, you wanna make sure it's done.
Okay, yeah. Is there anything that's coming that I need to get this done before then, along with all the other things I'm thinking. Good. All right, so will you will delay cause any injury or harm? We have to ask that question. This is nursing judgment. So if I don't wake the patient up and get the vital signs, will it cause any harm to my patient? That's what we have to ask. All right, then, are you more worried about the tasks, your instructor, or doing the right by your patient? Everybody would do right by the patient. You'd let them sleep. And then your instructor says, why in the world did you do that? We already talked about this at your midterm. You're supposed to have your vitals recorded and put in the chart. What are you going to say? You're going to stand there in fear, aren't you? Yeah. No, don't. You have the information. We just talked about it. My patient, second patient, I do not have vital signs on because. And these are the reasons why. Guess what? They're probably going to say that was a great decision that you made. All right? So what's your plan for the day? Where are we going to take it from there? Don't be afraid of us. And just because we say something that you need to improve on, we were all there too. That's not bad, because sometimes you don't have the insight of yourself to know that you could be better, and they're pointing it out. So don't be afraid of us. We're not there to, we're there to make you better. And if you take it as that, you're going to do fine. Okay? But don't be afraid to explain when you gathered the information and you know about your patient. Okay? All right. It is 11 o'clock. We're going to switch. Guys, take a, 10 minutes. Okay, be back no later than 11:08. And we're going to get started on stress and